So, quick breakdown of the hip airplane, which is an awesome exercise that I would recommend throwing into your workout before doing a lower body exercise. Now, if you're someone that gets lower back pain, like in the lumbar, or if you get like SI joint issues, maybe you get knee issues or discomfort pain, whatever it is, after or maybe even during, say back squats or deadlifts, then this is something that I'd highly recommend doing before you do those exercises. I'd also recommend doing them anyway, just to improve your function before going into them, even if you don't experience pain, just to kind of future-proof your body ongoing. Now, this is the hip airplane, which is designed for your pelvis to rotate open, and that will increase your external rotation of your hip. And then as we close the hip, that's going to improve internal rotation of the hip. So that's number one. It's going to improve internal external rotation, which is your mobility. And then number two, it's going to improve your stability. So if we have good mobility and good stability, then that allows the muscles to work effectively and efficiently when we're doing our normal heavy compound exercises like a squat or a deadlift. Whereas if we're unstable and or restricted in mobility, that is going to transfer and be absorbed by our more passive tissue, which is more like our joints, our connective tissues, and that's why you may feel it in your lower back, SI joint, or your knee, for an example. So let's have a look. Two ways of doing this: unsupported and supported. The full version that I want you to work towards, which is this, which is unsupported, you're going to hinge over like this on one leg. You're going to try to rotate your hip open without falling over. Rotate that hip open. As you can see, it's quite challenging. And then you're going to close the hip down like this. Now what's happening here is as I rotate my hip open, I'm contracting and shortening the muscles here. So that's creating a bit of strength in my glute med and the muscles here. And then as I rotate down, I'm then getting a good stretch through the glute med. So in the side of my hip here, you should feel a stretch. And the way that I cue this with clients is imagine that you have a laser beam on each corner of the hip. So you've got two laser beams pointing down like this. As you rotate open, try to get those laser beams as far around as you can. And then as you close it, this is the important one, that you bring those laser beams not just to neutral, but past neutral, and get that as far around as you can, like this. And bear in mind that you're trying to move the laser beams that are pointing from your hips, not your shoulders. So I don't want to see this kind of false movement from your head, shoulders, or your leg. I want the movement to be coming from here. So keep everything as straight as you can and limit movement elsewhere. Now, if you struggle with balance or range of motion, getting the full range of motion through the hips, I'd recommend first starting with something like a barbell or a dowel. You can hold on to anything really. But basically something that's going to give you a bit of stability, a bit of support, and that will allow you then to really work on that full range of motion and feel what you're supposed to feel, and then build the skill of doing it. And then it might just take you a couple of reps, a couple of sets, it might take a couple of weeks, it might take you a couple of months, but there is into beginning of your sessions, and then at a certain point you'll feel that you start to improve range of motion and the skill of doing it and your stability, where you can start doing it without holding on to anything. And that is when there'll be a massive transfer into how you feel when you're doing your lower body exercises like squats and deadlifts, and that'll make all your joints function, feel much better for you to get more out of your lower body training.